Hi, I'm Dr. Taylor Shank. I'm a licensed clinical psychologist. While I do generalized therapy, I also have specialized training in perinatal counseling. If we think about the word perinatal, peri meaning around and natal meaning time of birth, so that kind of encompasses perinatal therapy around pregnancy and then postpartum. A perinatal counselor has specific training on understanding what is happening for the birthing person during this time period. So knowing things like a pregnant person needs more sleep or needs to eat more, needs more nutrients. It can be important to kind of know those kinds of things, and then just like mentally and emotionally it can be an intense time. So understanding the specific needs, the specific challenges of this time is something that a perinatal counselor can offer, as well as going into like the maternal-infant bond, the attachment that you have with your baby and maybe things that are getting in the way of that attachment. If you had an unplanned pregnancy, weren't feeling ready to be a mother, or weren't sure you ever wanted to be a mother, and you have a baby now, that can be it can feel difficult to kind of have that attachment. If you're feeling resentment or just unsure about how to care for this baby, maybe you're afraid of making a mistake, those are things that we can kind of specifically touch on and work through. So you don't have to be in therapy for years. Short-term therapy is becoming much more common. Even if we met for 3-4 sessions, there's a lot of tangible work that we can do in that time. I would also say that if you are having reservations but you're kind of curious about therapy, you can come in and meet with me for one session. If it doesn't feel good to you, you don't have to continue. We can kind of meet, feel it out, see how it goes, and then schedule if that's something that you're interested in doing. But you can come in and just see what it's really like.